Hi, my name is Lucy and I'm 49 years old. In 2022, I was diagnosed with atrial fibrillation after feeling very unwell for 4 years.
Hello, I'm Claire Martin and I'm a consultant electrophysiologist, which is a specialist in heart rhythm management, and I work at Royal Papworth Hospital and at the University of Cambridge. Atrial fibrillation is a rhythm abnormality of the heart. Sometimes atrial fibrillation can come and go, and that's known as paroxysmal atrial fibrillation. But sometimes if people get atrial fibrillation, then it doesn't go away by itself, and that's known as persistent atrial fibrillation.
I was definitely having to do less in my life because I just didn't have that energy to do things. I had periods when I was short of breath, or had a tight chest like anxiety, or was very hot, and all of these were symptomatic with menopause or perimenopause symptoms. When I was going to the doctors, they were prescribing HRT to try and combat that, but of course my symptoms didn't go away. When I was really feeling quite unwell, I had an ECG done at the doctor's, which highlighted that my heart rate was extremely high. I then went and had an echocardiogram, which showed that my heart was enlarged and was explaining why I wasn't feeling very well.
The treatment options depend on your symptoms. For some people, it may be that they just require some medication, either to try and prevent them going into AF or to try and control their heart rate better when they do go into AF. However, for other people, it may be that what's most appropriate for them is a more invasive treatment to try and get them back into normal rhythm. And then in these cases, we usually recommend an ablation procedure.
I was introduced to Dr. Martin, and it was her recommendation to go through the cardioversion and ablation procedure to correct my atrial fibrillation. One of the benefits of using this ablation technique was that it was less likely to damage the surrounding structures of the heart.
So pulse field ablation is a relatively new treatment modality for AF. The underlying strategy in the AF ablation for PFA is still similar to other ablation techniques, and that the main aim is to electrically isolate the electrical signals in the pulmonary veins, which are the veins that are running from the lungs into the left side of the heart. Pulse field ablation is certainly an area of promise because of the way that it delivers the energy to the tissue. It actually more specifically targets the heart tissue than the surrounding structures in the heart, so for example the nerves and the blood vessels, and so it has less chance of damaging these other structures.
Since the operation, my quality of life is 9 out of 10. I'm able to do the things I want to do, working in the garden, walking the dogs, going to the gym. It has massively changed my life, and at 49 I didn't want to feel restricted or unable to be with my children, to work, to be busy and enjoy time with friends.
It's very important to continue looking after your health in the long term after you've had an ablation. If you have high blood pressure, it's really important to make sure that that's under control, and also if you have diabetes or any other medical conditions that could be contributing.
The ablation procedure has enabled me to live a happy and active life.